Welcome to Schulich Medical Improv Live, where improvisational theater is used to develop teaching skill in the field of medicine. I'm your host, Guy Smithers in Quebec, and people always ask, but no, I am not a doctor, I just play one on TV. Today, we have an exciting show planned in which three residents will take turns improvising scenarios with our own expert, Dr. Gobb. Welcome, Doc. Okay then, let's meet our victims. Today's resident panel. First we have Mary from internal medicine. Next we have Pat from general surgery. And finally Nav from GI. That's not GI Joe, that's gastrointestinal, something I'm intimately familiar with. I know you're all very excited to get started, so let's reveal today's topic, the 1-minute preceptor. This is a commonly used framework for short teaching opportunities in medical education. Dr. Gobb, could you present today's case?
Sure thing, Guy. So what we have today is Mr. Calvin James. He's a 45-year-old man coming in with, let's say, about an 18-hour history of a headache. His vitals are as follows. Blood pressure is 150 on 90. Heart rate, 105. Respiratory rate, 16. Satting 100% on room air. And his temperature is 36.5. We also happen to have his most recent head x-ray.
Fantastic. Okay then, please take your spot and let's get started. Mary, would you be so kind as to enter the scene? Let's see what that first scene is. Get a commitment. Something I didn't get from my first 3 wives. Okay. Although it will be challenging to narrow down a differential and decide what is really going on with the patient, we should hear Mary clearly expressing her clinical judgment. Let's see how they do. Ready, set, improv.
Okay, Mary, what do you think is going on with this patient?
Honestly, I just think he's suffering from a common migraine.
Migraine. So, what investigations would you order then?
I don't think I'd order any investigations right now. We could consider doing an MRI in the future.
Huh, okay. What are we gonna order for Mr. James then? How are we gonna make him feel better?
I think I'd like to just give him 50 milligrams of sumatriptan right now. Maybe send him home with a prescription for another one-time 50 milligram dose in case his symptoms don't resolve in the next 2 to 3 hours.
That's fantastic. 300 points for Mary for that fine performance. Those points aren't worth anything, except maybe a small coffee if I can afford one. Pat, you're up next.
All right.
Our second scene is called Probe for Supporting Evidence. I sincerely hope we're not going to witness any uncomfortable probing, but I hope you brought your gloves. I've got mine, and I hope my doctor's hands are a little smaller. We should hear Pat provide some rationale to support Mary's diagnosis. Ready, set, improv.
All right, Pat. So now tell me, what led you to decide that Mr. James was suffering from common migraine?
Well, his pain started yesterday afternoon while he was out hunting. And he's been taking 200 milligrams of ibuprofen every 6 hours, but it hasn't really relieved his pain. Now, he describes his pain as stabbing, and it radiates from the front down his jaw. So with those symptoms and the pain rating of a 10, I'm thinking common migraine.
Did you consider anything else in your differential diagnosis?
Well, he's been to a forest, so I was considering West Nile. There's lots of mosquitoes in the forest. But he hasn't had any fevers and he hasn't reported any vomiting, so I still think common migraine.
That's incredible, Pat. You're clearly as talented a physician as Mary here. 1,000 points apiece. Enough for an ice cap, if you share it. Moving on now. This one is for Nav and Dr. Gobb. Scene 3. Teach general rules. 3. Our expert doctor will now step in and briefly teach the learner, staying focused on the identified issues. Whenever you're ready, go ahead.
All right, Navjot. Heard the suspected diagnosis and the rationale. Now you'll find that in general, most headaches end up being benign. But what have you learned about the patient's history today?
Mr. James doesn't really have a history of migraines, but what I did find out is that he was hunting with a group of his buddies at the time of the onset.
Okay. And does any of that seem peculiar to you?
It did prompt me to take things a little bit more seriously because he had to cut his outing short because of this reported pain.
So it's important to always consider your patient's history to make sure that nothing is missed.
What a sharp diagnosis. Can't see our residents missing anything. We only have 2 scenes left. 2. Can't contain my excitement. Must stay focused. I love this game. This is for Mary and our expert doctor. Scene 4. The scene is reinforce what was done right. We're going to see Dr. Gobb emphasize specifically what our residents have done well. I don't want to cut to any conclusions, but I don't think this guy is going to make it. Take it away.
Mary, you did a great job of using the pain quality assessment scale in your evaluation. So the fact that you use that really allows you to understand what types and aspects of pain our patients are feeling.
That was fantastic. 1,000 points to Dr. Gobb for finding something right. Good job taking a stab at it. Well, we're almost to the end of the show now. One final scene for our illustrious doctor colleagues. Pat, if you may. Correct errors. This may be a more challenging scene as Dr. Gobb tries to find appropriate language to specifically point out to Pat why we might lose this patient, especially if we keep playing this game. Go ahead and start the scene.
Pat, how do you think that went?
I think it went pretty well. We have a solid diagnosis and a solid treatment plan.
That's true if our patient was actually suffering from a migraine. So let's take a look. We know that he was on a hunting trip. We know his most recent set of vitals. Taken in isolation, that might suggest a diagnosis of migraine. But I think if you were to look at the most recent x-ray as well, it would tell a different story.
Incredible! Minus 500 points to all 3 contestants for missing the knife in the skull. Well, I hope you've learned a few things about taking the opportunity to teach in the moment. Here's a recap for our learners at home. Number 1, get a commitment. Number 2, probe for supporting evidence. Number 3, teach a general rule. Number 4, reinforce what was done well. And finally, number 5, correct errors. That's another cutting-edge performance of Medical Improv live at Western University. Thank you for joining us.